Brittany? All right, my name's Mackie. I'm going to be your student physical therapist assistant for today. So we're going to do a couple tests today to first check your range of motion in your trunk, and then we're going to do a muscle test to see how strong your neck's going to be for today. Okay? Do you have any pain right now before we get going? Okay. Awesome. So before we do anything, I'm going to lower this down so you don't have to jump off the table. Tell me when your feet touch. When you feel comfortable. Okay. Okay. So go ahead and stand on up for me. So the first one we're going to do is extension. I need to grab a pen. So we're going to do lumbar extension. So what I'm going to have you do is you're actually going to have your hands on your hips when you do this. And I'm just going to have you bend all the way back just like this. Okay? So when you do it, I want your legs nice and relaxed. Try not to lock your knees, but I don't want you to bend them either. Okay, so we're going to do the motion just in our back, and we're going to go straight back. Obviously, remember to breathe. Don't hold your breath or anything. And just do it to where you can. Okay? So go ahead and show me that motion with your hands. All the way back. Perfect. Just like that. Nice, good stretch. Okay, so when I'm doing this, I'm going to need to do a couple measurements on your back, and I'm going to need to see some skin. Is it okay if you have your shirt up, or would you rather have a gown on?
That's okay, you can put my shirt
up. Okay, so I'll go over here, I'll go behind you. So go ahead and lift that shirt up for me if you can. I'm going to have to lower this down just a little bit. So right now I'm going to find your PSIS on both sides, and then go right in the middle. And I'm going to measure with my centimeter here, up to 15. It's going to be right there. All right, Brittany, so whenever you're ready, go ahead and do that extension all the way back for me. All right, hold it right there. Nice job. Is that as far as you can go, hon? Okay, so go ahead and relax. So I got 7.5, so that was about 7.5 centimeters. So 30 degrees of extension is normal, so I can tell Brittany is at about 30 degrees, if not a little bit more. All right, so now we're going to do your muscle test. So go ahead and lay down on the table here, and have you lay on your back. How's your day going?
Awesome.
Okay, so we're going to test your muscles right here. So we're going to do neck flexion. Okay, so what I'm going to have you do is just bring your chin to your chest. And then during the actual test, I'm going to have a little resistance here, and I want you to just keep your head in this position. Okay, so go ahead and show that position for me. Yep, perfect, just like that. So when we do it, again, of course, remember to breathe. I'm going to have my hand where your hand is actually on your stomach to feel for those muscles down in your abdomen. And I don't want to feel a contraction, because we want all the contraction to be right here on your neck. Okay? And then when you're doing it, make sure you keep your shoulder blades touching that table. We want to just be moving in the neck area, okay? Does that make sense? Okay. Reach up a little bit more. So yeah, go ahead and put your hands on your hips. So is it okay if I touch you in the areas? Okay. All right. So go ahead. So we're going to do it, okay? So bring that head up. And then, yep, perfect. All right. Hold it right there. Hold it right there. Hold it right there. And relax. Nice job. So I didn't feel any contraction in your abdomen, and I could tell it was all in your neck, and you're a 5 out of 5. Because you were holding against maximum resistance. And the muscle that we were testing for neck flexion is your sternocleidomastoid. Say that 5 times fast. And then your scalenes on the side. All right, do you have any questions for me? No? All right, well, you can go ahead and sit on that. We are done for the day.
Thank you.
You're welcome.